Our topic for today is the endangerment zones for massage. Let's start with the orbital eye cavity is in danger zones on massage because it contains the globe, vessels, nerves, lacrimal gland, extraocular muscles, tendons, and the trachea, as well as pads and other connective tissues in the eye. The next one, the anterior triangle of the neck, also known as the throat, contains the carotid artery, jugular vein, and vagus nerve, which are located deep to the sternocleidomastoid muscle, the SCM muscle. Sternal notch area contains nerve and vessels to the thyroid gland and the vagus nerve. The next one is our posterior triangle of the neck. That one with the yellow. The posterior triangle of the neck, also known as scalene triangle, contains the nerve, brachial plexus, brachiocephalic artery, and veins superior to the clavicle and the subclavian arteries and vein. Next one is the umbilical, also known as navel or belly button. Around it lies abdominal and descending aorta, liver, our linea alba, lumbar plexus, vagus nerve, and also above is the xiphoid process. So that is also included in our endangerment zone of massage. Other one is the radial pulse. The radial pulse, in a lot of cases, complication in radial pulse area may occur, including partial or complete loss of feeling in the hand if the injury caused by pulling of hand or massaging the endangered zone. Totally no massage in a radial pulse area. Radial nerve control bicep muscle. It also helps extend the wrist and finger and provide sensation in part of the hand. Also, radial nerve is close to the bone in the upper arm, so it's vulnerable to injury like massage. The next one, antecubital, is also known as front of our elbow and contains the brachial arteries, cubital vein, median nerves, radial arteries, and ulnar arteries. Next one is our floating ribs, also included in our endangerment zones for massage, because putting too much pressure of massage can harm the floating ribs. These ribs can slip out of position, putting pressure on internal organ, and they can also be broken as a result of a trauma, causing considerable pain. The next one is the sternum and the xiphoid process. The sternum and xiphoid process is located along the midline of our chest. Makes area safe in massage because we are not allowed to massage chest area. But just in case we massage the sternum area, we need to do it with caution and for a seconds only while watching reaction of our client. The sternum can only rub vigorously with our knuckles of a closed fist and with light pressure. It's beneficial as well because it helps to boost immune system stimulate or awaken the heart and lungs, but wrong pressure can cause a problem. So, can be massaged but with a caution. That's why it makes it in danger zones also for massage therapy. The next one is the axilla area, also known as armpit. Contains the brachial arteries and brachial plexus, axillary veins, nerves, and arteries, cephalic vein, median nerve, muscular nerve, radial nerves, and ulnar nerves. Armpit massage helps to open tight muscle in our shoulder and our shoulder blade too, as it lies under armpit. The origin of coracobrachialis muscle, insertion of latissimus dorsi muscle, and subscapularis muscle. But when in doubt and you are not sure the exact location of the said muscle, avoid the armpit in your massage. Next one is the spinous process. Spinous process lies throughout the spine. It's a bony projection of the posterior of each vertebrae, also known as backbone. The spinous process protrudes where the laminae of the vertebrae arc joint and provides the joint of attachment for muscle and ligament of the spine. These are levers both for muscle of posture and for muscle of active movement. We can massage all around the spine in different pressure, but not the spine itself. Next one is our kidney area, and it is the one who remove waste product, remove acid that produced by the cells of our body to maintain a healthy balance of water, salt, and mineral. Kidney is lies in our lower back. The lower back is also endangerment zones for massage. It is important also that we address the lower back properly with caution to take care of our floating ribs and also our kidney and our abdominal aorta. A lot of people encounter lower back pain. That's why it's important that every time we perform a massage, we don't skip massaging the lower back. Massaging the lower back helps improve the elasticity and flexibility around the joints of our hips, so increasing range of motion. A tight lower back accompanied by pain, dull ache, and feeling stiff, tense, and contracted. That's why we can massage the lower back, but with a caution. The other one is the groin, the inguinal, also known as groin, located lateral and inferior to the pubis and medial to the sartorius muscle, and contains the external iliac arteries, femoral arteries, great saphenous vein, femoral veins, and femoral nerves. That is the inguinal, our groin. Next one is the popliteal fossa, also known as the back of the knee. So, contains the popliteal arteries, veins, and the tibial nerves. Let's review again The endangerment zones for massage in anterior side of our body. That's included the orbital eye cavity, the anterior triangle of the neck, our sternum, axilla or the armpit, the xiphoid process, the antecubital, the front of the elbow, and the radial falls, and the umbilical, our navel, and the inguinal groin, and on the posterior side is the triangle of the neck, the scalene triangle, the spinous process, the floating ribs, our kidney area, and on the popliteal area, the back of our knee. Please subscribe to my channel.